Good evening to all of you from New Delhi. My name is Kaustup Bandyopadhyay from Participatory Research in Asia, based in India. I'll be your moderator for today's webinar on dynamics of state civil society relations during COVID-19, lessons from India, Israel, Hungary, and South Korea. I'm delighted that you could join this webinar today. Friends, we are going through an unprecedented time. According to WHO, as of today, there have been 43 million plus confirmed cases of COVID-19 and including more than 1 million deaths. To check the spread of coronavirus, many national governments have imposed lockdowns with various degrees of restrictions and preparedness. Some were well planned, others were abrupt, and still others have had no plans. The pandemic and the subsequent lockdown have totally exposed the tremendous social, health, and economic inequalities in our societies. In this context, the civil society has come forward to extend solidarity with the people who have been impacted by the pandemic, lockdown, and exacerbated inequalities. However, it's obvious that civil society in each country had to relate to the state authorities with varying degrees of cooperation and contestation, depending on the historical relationship between the two. It is in this context we will discuss the following key questions in today's discussion. First, what role civil society has been playing during the COVID-19 pandemic in each of these countries? What opportunities and challenges civil societies experience to play these roles? Third, how has the state enabled civil society to effectively respond to pandemic challenges? And fourth, what should be done to strengthen relationship between state and civil society for increasing community resilience, reducing inequalities, and accelerating economic recovery? Friends, we have a galaxy of panels today, and all of them carry decades of solid research and academic work on the subject. It's my privilege to introduce them. I will share more details introduction on the chat box one by one when each of one comes to speak. So we have Professor John Van Til, Professor Emeritus, Urban Studies and Community Development in Rutgers University, USA. He is also the Executive Secretary, Civil Society Design Network. We have our first speaker. John will tell us the background about this study. And our first speaker will be Professor Agnes Kover-Van Til, Associate Professor of Social Science and Director of Institute of Social Studies, ELT University, Hungary. We have with us our third speaker, Professor Hillel Schmidt, the Center for Study of Civil Society and Philanthropy in Israel, the Paul Beirut School of Social Work and Social Welfare, the Hebrew University of Jerusalem, Israel. We have Professor Bok Georg Young, Assistant Professor, Nonprofit Concentration Coordinator, Department of Public Administration, Kean University, based in the US. He'll be our fourth speaker. And then we have Dr. Rajesh Tandon, Founder President of Participatory Research in India, based in India, Participatory Research in Asia, based in India. And he's also UNESCO co-chair on community-based research and social responsibilities in higher education. So friends, we are all set and ready to go. Of course, by this time, we all are familiar with the Zoom platform, but allow me to take a few minutes to remind about a couple of features. You can use Q&A to the bottom of your screen for all your questions and comments. I would request keep the use of chat box to minimum so that we can get all your questions and comments in one place. And please keep your mic muted unless you are speaking. Friends, we are also on Facebook Live here. I will share the link in case you want to also watch it on Facebook, or request your friend to watch over Facebook. You can do that. So without much ado, let me first introduce Professor John Van Til, Professor Emeritus, as I said, from Rutgers University. He will be giving us the background of the NPS study on civil society. But John, when you speak, please also introduce our dearest colleague, Dennis Young. He is not speaking today, but towards the end of it, if we could pursue them to speak a few words. John, please give us the background. Why did you decide to do this study? And what are you going to do with these study findings? And what are the future plans?
Well, thank you very much, Kostov. This is an absolute delight to be able to work with you, with Rajesh and Priya, and with the nonprofit Policy Forum, which is edited by my dear friend and colleague, Dennis Young. And Dennis is with us today as well. The idea of a special issue for that journal came about this spring during a Zoom call among colleagues who had spent their careers in the study of civil society and the building of civil society. Hillel's one of them, Dennis is one of them, Rajesh is one of them. We call ourselves the Civil Society Design Network. Totally informal. There's nothing formal about us. We're not chartered or anything. And we were talking on a Zoom call, and the idea came up of looking at a number of countries and examining their response to the COVID-19 pandemic as it was taking form, thinking of some countries that usually don't get featured in the headlines. So we picked a number of countries, 10 of them actually, between London and Beijing. And several are represented here today in India and Israel and Hungary and South Korea. And we also are looking at and have colleagues who are working in Romania, in Austria, in Germany. And when you add it all up, I think it comes to 10 at this point. These papers are being written right now, and when they are completed, and with the advice of the editor-in-chief, Dennis Young, and the good works of the special issue editor, Agnes Cover-Van Til, we are on a fast track to a production of a special issue on third sector and government relations as they are taking form in these countries of the world, and we hope other countries as well, in dealing with this unprecedented situation. Our focus is really on civil society, although I think all of us recognize that a good society requires each major institutional sector to do its job, to be efficient, to be effective, to be responsive. Government certainly plays an important role, pretty much the central role when a social crisis of this sort emerges. Business plays an important role always in societies. The core culture plays an extremely important role, family, kinship, neighborhood, and so does civil society. Civil society is an entity of organizations and activities evident in every society, that really provides three very important functions, gifts to their society. It provides a whole range of services to people who find themselves in need, particularly needs that are not met, at least partly for a time, or maybe in some societies, it seems permanently, by government, by business, by the core culture. But service is not the only thing that civil society provides. Advocacy is a major contribution. Stepping in and querying, questioning, wrestling with decisions that are made by the other larger sectors, government and business in particular. And then there's a third function that civil society does, and that is to bring together people in issues of making meaning of life. Often that's a set of religious institutions, which are really part of civil society as well. Now, as we develop the special issue, we're beginning to see some themes beginning to emerge. One of the themes that we're beginning to hear about, and I think we'll hear more about it today from our colleagues, is the way in which a grand crisis, a huge crisis like the COVID-19 pandemic, makes very important impact on organizations in the third sector. Most of that impact is disruptive. It challenges to do things that haven't been done before, but it also puts a real rend into the financial basis of many of these organizations. And we'll hear some about that today. But there's another part that is beginning to emerge in some of our studies, in almost every one, I think, that I've read so far. And that is that individuals and groups and smaller groups of people are often motivated to develop new ways of cooperation and collaboration and helping and dealing with the problem. And out of this may come a set of rejuvenated, revised organizations that will assist in rebuilding the third sector, rebuilding civil society, even though the short-term financial impact would appear to be very discouraging at this point. So civil society and its relationship to government is what we are about. We have a wonderful panel here today, and Kostov, I will turn the panel over to you, but once again to say that Dennis, perhaps when we get near the end of the conversation, you and Rajesh, as the principals of our sponsoring organizations, the Nonprofit Policy Forum, the major intersectional journal in the world, and Priya, always a major force in terms of participatory research in our world. We are delighted to be part of this event, and Kostov, I'll turn it back to you.
Thank you so much, John. It was a comprehensive background in a short time. We look forward to hearing all the panelists today. So without wasting any time, let me invite Professor Agnes Kovar-Vantin to present the Hungary country study. Agnes, all yours.
Thank you very much. It is really good to see you. You know, we are separated from each other, and it is really a good and big pleasure to see face-to-face people, if not in person, but at least through these cameras. So let me share my screen, and I just would like you to see my slides.
We can see your
Can
slides.
you see?
Agnes.
Yeah.
We can see it. If you go full
Okay,
screen, that
I
will
go
be fantastic.
I go there. Okay.
Great.
Thank you very much. So first of all, I would like to refer to my colleagues who we put together the research and this paper for non-profit policy forum, Attila Antal and Isabella Deák. So we are the authors of this paper that I'm going to present for you. Okay, I try to, wonderful. So first I would like to give you a little overview, very short, about the pandemic in Hungary. Unfortunately, it is very similar as anywhere else. But let me have something before I continue. I can see the clock now when I'm in full screen. So would somebody be very kind and let me know when I have only 3 minutes or 5 minutes? John, would you do that? Thank you. So in this position, you know, the clock is not visible, so I cannot control the time at all. Thank you. So Hungary actually introduced a national emergency and exceptional legal order on the 11th of March. Actually, the exceptional legal order was not a new thing in Hungary because we have this since 2015 when the Hungarian government started it because of the immigrant crisis. So since then, actually, that is an ongoing thing. And somehow these two crises just met and I would say made stronger the effect. By mid-March, the country started to be locked down gradually, including the curfew restrictions. And that proved to be a very effective way of somehow stopping or not stopping, but controlling, I would say, the virus. There were different kind of restricting measures. I don't want to say them, but what could be very important, and probably we are not the only country in the world which has this, the focal points of the infections were in elderly homes and health institutions. The number of cases raised gradually by mid-April, then it started to decline due to these restrictions. So I just want to show you very few charts about that. So you can see the number of daily cases in April was, you know, that was the peak. You see that little hill, okay? And right now, so this is a timeline actually. So you can see the number of cases right now, which is uncomparably much higher. And I can show you a chart which shows data, comparable data. So the number of daily cases per million people. So you can see the April data where, you know, I mean, I didn't put all the countries, you know, just Germany, United States and Italy. So Italy was the highest then. And then you see right now, it is actually Italy is still again very high, but Hungary just somehow became much higher than the, well, not much, but definitely higher than the United States and much higher than Germany. So this is a kind of international comparison. So, you know, the lockdown just was terminated mid-June. I think 18th of June was this kind of emergency regulation was terminated and left behind pretty big, as everywhere else, pretty big economic problems and a lot of unemployed people. So this is a little chart about the number of registered unemployed people, which is actually higher because there are much more non-registered unemployed people. Oh, sorry, wrong direction. As an introduction, I would like to tell something about the antecedent history, or the history of the civil society and government relations, the current government relations, which is a very problematic relationship, I think, pretty much corrupted and deteriorated. It started in 2010. I don't want to spend too much time with this because we just recall this whole story again at the beginning of our paper and just remind people or give information about the latest attacks against the civil society in Hungary. So, I mean, in the last 10 years, civil society was attacked several times from several perspectives. One of the biggest attack, I would say, or deterioration is that the government find a way how to divide the civil society to a good and a bad part. So the good part is, of course, the unconditionally loyal gongos and pseudo-civil organizations, and the advocacy or watchdog organizations or human rights organizations are, of course, the bad organizations who are or which are the enemies of the country and somehow representatives, or not representatives, but worse, soldiers of foreign powers, because they receive some financial support from outside of the country, from different funds like the Norwegian fund or Swiss fund. I just would like to turn to the main point of my little presentation, which was carried out at the end of this summer, somehow at the end of the first wave. The nodal points, what we wanted to know of this research was about, we wanted to know about the organizational resilience and flexibility of these CSOs, non-profit civil organizations. We wanted to know whether they were able to accommodate to the significantly transformed environment, whether they could develop new organizational strategies and so on. Then the second field was about the sources, the financial support, whether these organizations, how these organizations survived, whether they had enough financial resources to support their target groups and to survive at all as organization. The third territory of the questionnaire, I would say, was that whether how these organizations could contribute in mitigating the hardships, so what kind of activities, services, networking they could do. And the last one, of course, the partnering issue, whether how they could partner and whether they could partner at all with local governments or governmental agencies. The methodology of this research was partly interviewing, partly a semi-structured questionnaire that we ran through, of course, online through the internet. But we had a lot of Zoom and Teams and different other electronic meetings with representatives of these organizations. We somehow, of course, introduce the main characteristics of these organizations. But this is pretty important and interesting to say. So these organizations focus on very multi-faceted activities. So they carry out different kind of activities at the same time. So most of them have advocacy function, human rights watchdog, and so on. They represent different kind of minority groups and so on, but that's the next chart. But at the same time, they provide educational, cultural, social services and community development as well. The target groups, mainly disadvantaged groups, poor, Roma, women, people with disabilities, homeless, different age groups, sexual minorities and professional groups. The location inside the countries, about 60% of the organizations involved into this research stay or locate in Budapest and rest in countryside. So the first, organizational conditions. 80% of the organizations was able to change and was able to transform their activities and their office into home office and online work. Some of them has to shut down totally. The nature of change, that was another research carried out by NEOC, that's the Nonprofit Information Center. And we compared their data with our data. So they found very similar result. About 15% of the organizations, and we cover total different kind of organizations, about 15% of organizations just had to shut down. And they had a lot of problems with moving to the online operation. Okay, this is another very interesting, this is our research, very interesting issue here or problem here. We actually related and correlated the organization's negative vision about future or pessimistic expectations, positive, negative, and semi-negative vision with the existing organizational conditions, which were sufficient or not sufficient according to their reports. And we can see that, unfortunately, those organizations who have pretty good and sufficient organizational and material conditions for running their projects. So still those organizations have very negative vision about the future. So there were different kind of indicators what we met under this kind of negative vision. So the financial support, what they expect in respect of their target groups and different kind of policy expectations and so on and so on. And they were pretty negative. What was interesting, mostly the Budapest organizations who receive a lot of corporate fund and foreign donations. So they provided and they give the most positive vision about the future. So it is very interesting, but at the same time, I did not mention, but that's an important information. I think these organizations who receive funds from abroad, they are actually stigmatized pretty much. Okay, So
if you can
I
finish it
know,
in 2 minutes.
I know, 3 minutes. Okay, thank you very much. I try to really be very quick and just got to the point, the positive point. Organizational resilience and flexibility was pretty good. They worked out new strategies, networking, that was really very surprising. They somehow found the way how to network with other organizations, and they ran joint actions. And this is a chart about what kind of services and assistance they provided to their target groups or to their people who lived in that very local neighborhood. And what is interesting here to see, the food distribution is much more important in the rural areas than in Budapest, for instance, and the distribution, different kind of basic hygiene products. It is very interesting. Of course, we know most of these organizations work in the the poorest part of the country, the east, economically pretty much bad conditioned part of the country. So it is really a kind of upsetting thing. You know, the most important thing was the food over there. But in spite of all of these, that was incredible movement, and in spite of that fact, the government didn't provide any kind of support to these organizations. It was an incredible movement, and not just among non-profit or civil organizations, but citizens. That was during the first wave. That was 81 community fundraising campaigns, and much more money was collected and distributed among people who were in need and who are in need, much more than a year ago, for instance. There were different campaigns. The Stay Home campaign, where civil organizations just provided very basic services for elderly people and or disabled people. It was incredibly vivid online life, you know, online exhibitions, online market, case management online concerts, stay-at-home festivals. So it was very vivid and very interesting. And what about the cooperation? There were some positive things, new tax rules, changing deadlines, which is, I think, important. And it was an action plan made by the Minister of Human Resource, which addressee was the local government and the civil organizations. But unfortunately, no money was not allocated to this program, to this action plan at all. One of the civil organization just followed up the local effects of this action plan, and they found out that there were no real cooperation between the local government, most of the cases, or only there were very sporadic cases, good cooperation between the local government and the non-profit organization or the service provider organization or the advocacy organization. 88% of organizations did not receive financial support at all. 2 organizations got a new contract in Budapest with the capital local government, which is an oppositional mayor and an oppositional government. So that this local government has a little bit different attitude towards these organizations. So, and the last side, there were a lot of restrictions actually, which actually were applied against, I would say, again the civil organizations, especially the organizations which had employers. They were left out of this economic rescue package. So the last summary and conclusion very quickly. I think the Hungarian civil society just very, very significantly and strongly proved that Hungarian civil society has a lot of potential. And they provided a lot of assistance, a lot of networking, and so on. The collaboration between the local government were sporadic, very rare, but at least sometimes it was really good. But it was very few cases or no cases when they had cooperation with the governmental bodies or organizations. Unfortunately, the government does not have trust in these organizations, and they have to have to work and live in a very adverse political environment. And this lack of governmental support greatly impedes the capacity of civil society organizations to provide services and assure advocacy, as would be so important in the time of this pandemic. Thank you very much. And I stop sharing now.
Thank you so much, Agnes. It was wonderful to hear. I'm hearing first time any post-COVID story from Hungary. I was particularly intrigued with the slides where we have shown the rural-urban differences in terms of needs of the people and the response of the civil society groups. But you also ended with a positive note that despite mistrust between the government and civil society, there are instances of cooperation, and particularly at the local level with the local government institution. Fascinating. Let me now invite Professor Hillel Ishmael. He is going to present the Israel country study. And I need to share the screen for Hillel.
All right, thank you.
Okay. Oh, it's not true. Sorry, Hillel.
No, it's about the same conclusions.
just give me a second.
I think the conclusions are universal, Hillel.
You can give we can move to Korea. All right. Thank you for inviting me to this session and to submit a paper to the special issue. And the topic of my lecture is No Love Story and the relations between the government and CSOs during the COVID-19 pandemic in Israel. And I will begin, next slide, please. Can you roll it? Give all yes, okay. I will start with a short introduction to the background, which is very similar in many countries. In the beginning of the crisis, it was February, the end of February, beginning of March, the characteristics of the government behavior was bewilderment and confusion, inconsistency of the government policy. Actually, they didn't know how to make decisions. I'm not talking about the process, I'm talking about the content and the relevance of the decisions that have made regarding the pandemic and the struggling with the COVID-19. The decisions were, most of them, political, influenced by interest group. Mainly special attention was given to some of the sectors like the ultra-Orthodox sector and the Arab sector, which the rate of infection was very high and still high, although they are moving better in the ultra-Orthodox and worse in the Arab sector. As a result, you can roll all the slide. As a result, the government actually declared a state of emergency for 3 months, which actually was expanded later with the first lockdown in Passover in one of the Israeli holidays, and the results of all this situation was a dramatic growth in the unemployment rate. If before the pandemic the unemployment rate was 3%, today is about 20%, with 1 million people are unemployed, with all the implications of the meaning of unemployment. And it was a deep economic and social crisis, while many businesses are out of businesses till now. So in the first wave, we can say that we have some relative success after 2 or 3 months during the March and May. And the Prime Minister appeared in the TV and said, okay, we overcome the first wave, you can have fun. And actually invited the countries of the world to learn from Israel how we can struggle and cope with the implications of this pandemic while the rate of infection went down. All of a sudden, they opened the schools, they opened the businesses, and we face the second wave with a dramatic increase of the infected cases and a second lockdown in the Jewish holidays last September for almost 3 weeks, and actually last Sunday they changed the decisions, and the lockdown is not anymore, and we are hoping to open the schools again next Sunday. But all the measures that the government took was inefficient and insufficient measures to support the economy, with some contradictory decisions that impacted the businesses till now, and the businesses were closed, universities were closed, etc., that many facts that you know from other countries. This is the background, which is very similar to many countries. But what we are concerned here, what were the implications for the CSOs? And I want to say that in this paper, I relate mainly to the organizations, and I'm not relating to the volunteering or the individual volunteering, which was differently and behaved differently. I'm talking about those organizations, the non-profits organization that actually contracting out with the government to provide social health, educational services to the population in Israel. And what we have found, that was a major decrease in the activities and program, and of course in the income. And also, next point, now you can run it, as to make present all the slide. A major decrease was also in the number of volunteers in the organizations. I'm talking about the organization, about 35% less, because volunteers were afraid to show up in the organization or to assist the clients because of the COVID-19. Most of the workers were on unpaid leave and laid off, and there was an inability to pay the salaries as well as to acquire equipment to cope or to protect the workers from the COVID-19. And only partial provision of the services were provided to special populations like the frail elderly, the children and youth at risk, children with disability, etc., etc. Also, the leadership of the organization, what we have here is an umbrella organization, the civil leadership, actually asked the government to allocate grants to support the organizations that are in deep trouble, and if I'm not exaggerating, are bleeding, that the government allocated finally only very limited financial support, which was complemented a little bit by the philanthropy. Till yesterday, it was in the Parliament of Israel, in the committee of the financial committee, that they asked why the money that was already approved is not transferred to the organization. And they say, they threaten the people of the officials of the government that they are not going to legislate anymore any laws in the parliament until this money will be transferred to the organization. As a result of that, there was an inability for the CSO or actually to the nonprofits or the providers of the services to cope effectively with the results of the pandemic and to provide the services to those clients that are really in the network of these organizations. So I was very pessimistic about this situation regarding the situation in Israel, specifically what we're dealing here with the organization, with the nonprofits or the providers. And the paper question are, why does government behave as it does and did not respond to the organization financial demand? It's very strange because they are working so many years together and they are considered to be as the long arm of the government to provide the services. But it so happened that I cannot understand why it's the behavior. And by the behavior, I mean some alienated attitude towards the organization and not providing them the means and the money and the resources they need. The second question in the paper is not the government policy toward nonprofit discriminatory compared to the other sectors? Because the government was very lousy and very inefficient also with their attitude toward the business and toward the policy toward the business. So maybe it's the character of the government, the bureaucracy, the red tape, the lousy government. They didn't actually discriminate, in fact, the organization, but this is the behavior of or the policy of the government that is true for all sectors. And finally, our relations are based on mutuality and partnership, as we try to, in the past, to define, to discuss, to describe the relations between the government, or is it alienation and mistrust or distrust between the two? So I think that the paper is, I'm sure that the paper is trying to explain what are the reasons for the government policy and what are the reasons for this situation from the government as to the government policy, and what is the role or the share or the part of the organization or the contribution, quote unquote, of the nonprofits to this situation. So trying to learn what is the government policy, I'm claiming that there is really misunderstanding of politicians in Israel and administrators and high-rank officials. What is the role of this organization in modern society? They relate to them only as an arm of executing services, but not talking about values. And I'm not talking now about advocacy organization or a change or social change organization, etc. I'm talking only about these organizations that are becoming some mechanism of providing services and not anymore. And I think they are actually the values in the eyes and the perspective, how they perceive the values of this organization, that they undermine the country's stability and the resilience of the society, and they are inefficient and ineffective in doing and running these organizations. I heard several times high officials and politicians say that they are even traitors. They are even you cannot trust actually this organization because they are talking about democracy, they're talking about freedom of association, they are talking about human rights, etc. And it's not actually the mainstream of a right-wing government that we have in Israel for the last 20 years. And they consider the organization to be very inefficient and ineffective, and they still employ old management techniques and not adapted themselves to the situation of modern society or the modern world. Also, what the government officials think that the management or the executives of the nonprofits are very running poor financial management. The executive don't have appropriate professional expertise to run the organization financially, especially in this crucial time. Also, another point, the organization always, the nonprofit human services, which is my area, always define their goals in some way that is very ambiguous and amorphous. What we want to do is to promote the well-being of our clients. it doesn't so understandable by the officials of the government that are looking now for measurable objectives and actually outcomes that we can measure and quantify. And they are talking something amorphous and talking about doing good to the people. It doesn't sound good to these officials. And the result is that what I found, and I cannot explain all this situation unless there is some alienation or some distrust and suspicious behavior on behalf of the government vis-a-vis this organization, because the evidence is that they are not allocated the money, even if they promise the money and the support of the financial support to the organization, it still was not transferred to the organizations which are bleeding, and some of them or many of them will be closed and die and disappear from the arena of the services. That means that the government does not enable the CSOs to respond to the pandemic challenges, and actually they found many troubles with that. On the other hand, I cannot ignore the role and contribution, what I said, quote unquote, of the organization to this situation, because the organization there is a high dependence, on the government funds. Yesterday we had a new report about the percentage that the share of the resources that's coming from the government. It became about 41% that the income is coming from the government. It was till now 50%, but still 41% is a very high dependent on the government fund. And what we have found, that if you are dependent on the government money, you don't buy the hand that feeds you, and you are not so much proactive against the government, and you don't fight against the government. Rather, you conform with the regulation and with the guidelines of the government in order to ensure the money that you need for your activities. Also, the sector in Israel, and I mean the third sector, is characterized by high structural organization differentiation and segmentation. 50% of the organizations in the sector are very small in terms of their revenues. 40% are medium, and only 10% are considered big, which control the 10% controls 84% of the government resources. But you have still a lot of redundancy and duplication in the sector. Many small organizations are competing for the same resources, serving the same populations, the same clients, and actually compete each other instead of cooperating, collaborating, or even doing some mergers that is needed in this time. Also, unfortunately, the lack of technology innovation is very, you can find it in the organizations that are not adapting themselves to new technologies, and the poor performance of the board. By that I mean that board members that were chosen or selected to be board members are based on their record and connections with the government disappear in this pandemic crisis, and they didn't do anything to negotiate with the government and how you can mobilize the support to promote the interest of these organizations, and doing some good work with government officials to promote and to reach and to gain actually the assistance they need. So what are the conclusions and the insights that I take from learning this situation, especially in this time of crisis? First of all, I think on behalf of the government, or from the side, or from the perspective of the government, there is a misunderstanding of the critical role of the organization in times of crisis and disaster. Unfortunately, we have in Israel too many wars in the past, and in the last war with Lebanon, the role of the CSO was very clear. They were first to serve the people. The government came after a week and came with the assistance to the people. So they don't understand really what is the meaning and how they can use the organization in these horrible times of the crisis. Secondly, I think that the organization had to work harder in order to change the government's attitude towards civil democratic values and human rights. What we have found even that the Ministry of Finance was reluctant to allocate money to nonprofits that serve the job seekers that or immigrants that come from Israel from different countries, and they didn't want to give money to allocate resources to these nonprofits that serve this organization. And I'm not talking about some laws that were actually enforced organizations that was considered to be leftist as to expose their resources and from where resources they get the money. So another point that I take from that the organization themselves don't take the advantage of the power revolution. By power revolution, I mean that if in the past we thought that power is attached to the position, now we know that power is attached to your knowledge, to your expertise, to your know-how. And actually the organization accumulated a lot of information. They are closer to the clients than the government. That the government is dependent on them and they don't take advantage of this situation. Although I'm aware that they are still dependent on the money, at least 41% that is coming from the government. But they have to be more proactive and take advantage of this power revolution, and they don't do it. Also, I think that we have to change the dialogue between the government from bureaucratic and administrative to what I'm trying to say, ideological discourse. Usually in the discussion between the government and the nonprofits are around the procedures, guidelines, and covering deficits. I think it's the time now that time is changing and we can divide the world before and after the pandemic, that we have to rethink the mission and the role of the nonprofits in the changing environment. I have no time to think now with you, but I'm calling upon to think what is the role in the next years and what will be the role and position of nonprofit organizations. Thank you, in a minute. Also, we are talking a lot, can you go back? Also, we are talking a lot about cross-sectoral partnership. Many are talking about cross-sectoral partnership. Some of us are doing research about cross-sectoral partnership. But unfortunately, we don't have so many partnerships between the government and the organization because of the reason that I mentioned before. And I call upon the government to encourage more collaboration and more cross-sectoral partnership between the government, the nonprofits, and the business. And finally, last but not least, I think that the involvement of the organization or the delegates of them should be in the government policy making and decision making. Until now, government officials don't take into account the information, the ideas, the ideologies, the know-how of the executives of the organizations. Even now, today, still struggling, open the schools or not, there is a big debate between the authorities and the power between the central government and the local authorities, which are ready to take the responsibility. This is the same thing with the organization. They are not sharing, they are not involved in main procedures of policy making and decision making about providing services and keep the democracy and human rights in Israel. Last slide. Thank you for listening.
Thank you, Hillel. Thank you so much. You have drawn some very critical conclusions, and particularly the need for working on both the sides, working towards changing the attitudes of the government, as well as building capacities of the civil society organizations. That's a critical lessons for all of us in many contexts. So let me now invite Professor Bok Gyo Jeong to present the South Korean country study. Bok.
All right, thank you, Gustav. And I would like to thank everyone, and also those Priya, and including Rajesh, and also our co-editors and of the special issue, and John Bantil and Agnes Bantin, and also the journal editor, Dennis Young. So I just got honored to work with everyone here. I'll share my screen now for my presentation. So hello everyone, evening and afternoon, morning, everywhere globally. So I'd like to share insights from South Korean case. So I heard a lot of very important insights from Agnes and Hilaire's point, and we are dealing with the same issue, but slightly different focus, probably some different kind of lessons we learned. I really learned a lot through 2 presentations. My presentation related to that about collaboration, about government and civil society, but I deliver slightly different kind of perspective. So a lot of news media these days delivers about how South Korean government did well excellently. So really it looks like just one man play and show on the stage. But if you look at this picture behind, there are a lot of actually coordinators and collaborators behind that make show successful and the real success. So I just want to see that probably we have to really focusing on those behind, those who is collaborating, who is supporting. And without that, how can government can do anything just alone? That's the question I brought through this case. So for that purpose, actually the Sungju Kim and North Carolina State University and I worked together, and with this perspective of a governance involvement. And then we looked at 3 components. One, how the government intervened and actually provided a service and its intervention, but at the same time, how civil society itself did its role. And then lastly, how they did collaboratively provided their service and also their contribution side. So first, statistics first comes that. So this is the data from early of the stage of coronavirus until the end of July. So that those data collected on around that time. So that until then was about 300 deaths. And also those confirmed cases about 14,000 cases. As of now, around this end of October, we have around 460 confirmed deaths, and also about 26,000 confirmed cases. So it's kind of still see some kind of the cases occurring, but it's not really huge second wave or type of the increase hasn't happened. So it's all based on the all efforts by government and also all citizens and civil society and overall. So I would say there's something not just beyond just one government efforts. So what's South Korean model of this quarantine and intervention? So a lot of news media and including even WHO actually highlighted a lot about South Korean government approach. They called it triple T. Of course, it's also WHO official approach too. So test, trace, treatment, those are 3. So, but these based on more agile, adaptive, and transparent engagement. So how did it happen? This is more about the early screening is very important. So they early screen test and then trace them through IT. So if anything happens, it's a trace system provides full transparent information. And people and civil society and citizen and people actually very participate well in terms of complying because to prevent the overall societal crisis. So government itself provide a lot of testing sites and screening sites. And it itself actually provide lots of different types of testing centers, innovative drive-through. Now it's actually widely spreading around the world, adopted by many other countries, and includes other type of approaches in terms of increasing those testing and also the trace and treatment. But it's not only just one single case. South Korea had very painful experience before. So I would say this is a learning effect. From 2003, 2009, there was a huge pandemic. Actually, at that time, South Korea was one of the top lists who actually highly devastated. So although the number is not as much as this COVID-19, but that was actually imbalancedly, actually, South Korea actually get the pain about the experience. So this immediate, very agile and transparent response actually based on those manual developed after that learning. So I have to emphasize that. So nothing gonna happen without learning and lessons. So I think today's session in that sense is very important. So provide lessons to each country and each society. So learning is more important than just ignoring. So that's I want to emphasize that from the South Korean government perspective. And in terms of those South Korean government actually facilitated testing toolkit development just right after, even right before actually became officially spreading. So it's also based on the learning from this previous experience. And also I would say that the IT was a key component from the beginning. South Korean government actually incorporated that IT as a key, the contributing factor. But at the same time, I would say it's not only testing and tracing about actually treatment. So it's very important to treat them actually fully cured and released and to integrate to the society. And South Korean government did 3 ways. The first, they separated about full treatment and also quarantine. So made a priority how actually approach considering the capacity of a healthcare system too. And also, about the capacity about diminishing the equipment, actually provided a lot of equipment. And also the care packages was provided by government. So people who got sick actually had a good treatment to be actually fully recover. That's a very important part. So not just ignoring it, but helping them to really recover. So that's one part. So I would like to use this framework. Actually, there are lots of theoretical discussion in the paper included, but not in this topic and presentation. So I will skip this slide, but I want to emphasize that the key point is that I think I really learned a lot from Agnes and Hillel, and then they mentioned about those decision making, how much civil society actually collaborate, actually contribute to the actually decision making part beyond just service delivery, and also how much they contribute to the public policy formation, just not beyond just implementation. So in that sense, actually, I have some kind of a similar kind of the questions. So that's why I brought this topic and the framework. So the data collection wise, the 19 central government ministries and also their website and their official announcement all counted by keyword search. And then 5 metropolitan government and their website and their official announcement all counted and measured and then classified. And civil society side, so we measured about their official report, and they conducted their own survey, nationwide survey, like think tank report. So we include that. And also we did news media reports, because sometimes news media report and also with some cases too. And additionally, we looked at actually that the civil society action as part of a government press release. All right, so I think I have time limits, but I will not go into all details. But I just want to say that this is all the chart and all of the Korean government and Untitled partnership. You will see 756 total cases was actually included in the analysis. And out of that, there's a lot of information about their partnership with without partnership. So I'll skip that. I'll have spend more time in the discussion session. And then this is the metropolitan, major metropolitan area, and it also includes just main prevention part, and also their partnership with our partnership. And there needs a lot of discussion and which cases included, but hopefully we'll have a chance at the end. But about civil society side, if you see a lot of actually civil society worked on their roles, and mainly those high portion is actually quarantine sanitation. But if you see their main focus is actually vulnerable group support and also social service gap support. So the impact of civil society, and then you'll see they actually went through struggle. So it's actually reported from their own think tank report, and a lot actually went through deduction of services. And also a lot of actually expanded about the shrunk of their programs. So that's the reality, though it's actually related to the resilience point about but at the same time, they continue to work on their main higher priority to helping those vulnerable groups. So those actually will continue. That actually consistent with other countries' presentations. But if we looked at additional typology about policy and also governance involvement, there's also, we see some balance, not just entirely implementation, service provision. The lots happened actually in the formation through an example about some council and committee task force, and government actually opened the channel and providing the opportunity, actually civil society and also private sector experts can join, actually provide some suggestions. So I know I cannot provide the full examples, but I just want to say the formation part is very important beyond just the civil society subsidiary role we usually assume, but at the same time, the governance involvement is very important too. So in terms of findings, I would not say this is a single actor play, because beyond those government role, there are citizens, there are people who really comply with that rules, not because of the enforcement, because of their safety, protecting those citizens, their senior colleagues and peers. I think that's more important, and we have to highlight, not forget. And also civil society always there, although they are struggling, they didn't actually give up even the challenges. And actually, even those donation actually even became higher thanks to not thanks to, after this COVID-19 pandemic. They showed some resilience point of that. And also, I would like highlight them those complementary role in the implementation, and also beyond just implementation role, about sometimes the policy formation, we should highlight more. But I have to say that, so when I say the civil society, I approach it more broadly, including even associations of private sector companies. So things like that. So I may say that civil society, especially in this kind of this crisis, can be more broadly approached in that how can actually they collaboratively work together to prevent actually response to this pandemic. So civil society, the overall contributed a lot, but civil society couldn't do anything probably if government didn't open the channel, I think. So in that sense, I would not say this is just one part contribution, is actually both. So examples, if, for example, the Office for Government and Policy Coordination, they provide lots of public hearings and council meetings. So they worked on providing, actually inventing a certain kind of approach. And also they provide some task force, as I see, and they provided some kind of a K-quarantine prevention model. So I would say maybe the last, question, we say 3T, test, trace, and treatment. But I think the teamwork, we should not forget in terms of a citizen and the people, and that actually really made it happen. So I see that with the same 3T, And then some countries is successfully implementing, some countries done. It's not about the model itself. It's about how those teamwork in the society and with the people and citizen and civil society make that really be effective. I think that's very important. So it should be 4T, not just 3T. And I think that's a very important message I want to deliver. So if you have any questions, please let me know. But I have to apologize as the excuse. I have a very the conflicting schedule obligation from my duty of university side. So I have to leave in about maybe in 15 or 10-15 minutes. So if you have any questions, please type in so that I can even answer while I listen, so that I can answer as much as I could before I leave. But if not, if any questions comes to me, I'll ask maybe moderator to deliver those, collecting them and deliver to me so that I can answer later on. But thank you for this great opportunity. Thank you.
Thank you so much, Bok. I think it was an excellent presentation and track-based treatment. That's the mantra that South Korean government took during the COVID-19. I think you have also highlighted why civil society organizations have not been able to work so efficiently, because the government was pretty much efficient there, and but the role that they have played in terms of partnering, networking, and providing support to the marginalized group, that's quite important. Let me now invite Dr. Rajesh Tandon, founder president of CREA. Dr. Tandon.
Thank you, Kostov. Thank you very much. Wonderful to listen to all the previous speakers. And for the most part, if I had closed my eyes and listened to them again, I would say it resonates with what happened in India and continues to happen. Perhaps more closely resonates with what Agnes was saying about Hungary, then occasionally resonate with Hillel, and very rarely resonate with what happened in South Korea. As we speak, let me put on my slide and let me make it full. Yeah. The title is Source of Life or Kiss of Death. And why this title? 32 years ago, Priya wrote a study with this title. And that was based on 12 country experiences. And the subtitle was GO-NGO relationship. This was 1988, 89, and civil society had not really occupied the lexicon at that time. So revisiting Source of Life or Kiss of Death. Now, as we speak, I haven't given you in my presentation details about the pandemic, though the phenomena have been no different from other places. But we currently have 8 million infections. We have covered 8 million infections, 120,000 deaths. Daily occurrence is around 40,000 these days. And the prime locations in the early part have been the metros, Mumbai, Delhi, Bangalore, Hyderabad, Pune, etc. You may have heard. Many of them are IT hubs, so globally known locations. And now, of course, it is spreading in other parts of the country as well. So let me see how I can move this. So I'm not giving you the phases and all that in detail in the paper contains. I'm concerned about time. I want to quickly come to the analysis and the interrelationship. So lockdown was on 23rd of March, sudden, severe, and total. The Prime Minister gave a speech at 8 p.m. and by midnight, everything was shut down. Countrywide, boom. Sudden, severe, total. It was initially for 3 weeks, and those 3 weeks became 10 weeks. So unlockdown began only after 10 weeks. So unlockdown began only in late May, early June. So what happened? Disruption in economy, livelihood, mobility, and health. Given the unequal infrastructure on access to public health, and given the fact that people were stuck and not able to move, everything was disrupted. Of course, we in the middle class were happy in our house. We were told stay at home. We loved home. We had rooms in the home, and we were told, don't go out. We didn't go out, and we were told wash your hand. We had water in the house, so we washed hands. But those who live on the pavements, those who live in slums, those who 7 or 8 people live in one room with tanker-based supply of water, how many times you wash your hand if you don't have enough to drink? And where would you go to maintain physical distance? Because you can only go outside in a park or on the street, but not at home. As a result, within a week or two, suddenly in India, we discovered that we have roughly 50 to 80 million migrant labor come from rural areas, stay in cities, and nobody had a count. But they started being visible. They started walking on the streets. They started running to go back home. They were stopped. They were harassed. They were sprayed by the cops. And they were stopped across provincial borders. There were no trains, no buses, nothing to travel by. But they walked. They walked 1,500, 1,800 kilometers in 50-degree, 45-degree centigrade summer heat of this country. And then we started, policymakers said, we don't know how many migrant labor are there. Even they went to the Supreme Court and said, we have no idea. They still don't have any idea. So the lockdown exposed what was already known to many of us of entrenched inequalities, not just in matters of health, but in housing, in livelihood, most informal. Roughly 90% of the workforce in India works in the unorganized sector of the economy. If you exclude the agricultural labor, you're talking about 250 million workforce. And out of that, only 30 million to 35 million have formal jobs. The rest work on informal jobs without formal contract, vulnerable, low paid, and therefore very, very scary situation. And they lost their jobs. Many of them didn't get paid from the month of March. They had to be evicted from the, wherever they were rented and living, and they had no food. So immediate and widespread response of civil society, and I'm including here formally organized civil society as well as citizens associations, including, as you know, in India, we have a long tradition of religious institutions playing philanthropic social service role. The gurdwaras, the churches, the mosques, the temples, all of them came out. Neighborhoods came out because they could see people hungry and walking on barefoot, So spontaneous relief actions. And the most important part of that was follow up on preventive health awareness. Because initially, like Hillel was said, government was confused, chaotic, they didn't know what to do. So what they would do is they would sit in New Delhi in some place and issue complicated instructions on internet in English. And when you know that only 20% of the population has access to internet and only 8% know how to read English, you can imagine nobody knew what was going on, and all kinds of television news people had their own spin on it. Civil society also worked very quickly to provide access to social protection benefits. Government initially announced free ration to everybody, even if you didn't have a eligibility. They announced 500 rupees, about $10 to transfer in every poor person's bank account. But when you go to a ration shop to get food, The ration shop doesn't have food for you. They don't know that you will also get food. And the money may have come to your bank, but bank is 20 kilometers away from where you live in rural area, and there is no mobility. You can't go anywhere. So how do you get money? So this is where civil society came forward. They negotiated with district administration, they worked with local governments, and they pushed that this whatever is made available becomes accessible, is utilized. And the most dramatic work of civil society was in terms of facilitating migrant labor to go home. Our estimate is that anywhere from 40 to 45 million people reached home back to rural areas in a period when no transport was available. After a lot of advocacy from civil society, some special trains were made available and some buses were made available. But civil society got links of migrant labor. They helped them with, because they ran out of charge on their mobile phone. Now, how do you charge your mobile phone? You know, in India, mobile phone call per month is very cheap, $2 a month, $1.50 a month. You can have unlimited phone calls. Data is, of course, very expensive. So most people have only call. They don't have data. They don't need data. But if you run out of mobile charge, most people go to a near tea shop, a vendor, a small newspaper vend, and pay $2 and get a recharge for another month. They don't operate on websites and they don't use smartphones to pay through debit card or credit card, which most of them don't have. So if you run out of charge, you can't even speak to your family back in the village. You can't talk to anybody. Civil society made this mobile charging possible. When they are walking long distance, they ran out of shoes and chappals. Civil society is offering them shoes, mobilizing neighborhoods to contribute shoes, shoe shops, chappal shops, giving free shoes, and creating a platform of communication so that stranded young girls from Mumbai could be safely taken forward to their homes 1600 kilometers in the east through a digital platform of civil society. Amazing work they did. Advocacy, Priya was a part of this, so we know number of details which we can offer. And it was recognized that if civil society had not come forward, migrant labor would have suffered much more than they have done. Lots of good examples of cooperation with the government. Very good examples of cooperation from the government. The government was, in the very few initial weeks, started senior people in the government saying, well, civil society is a great job. After a few more weeks, even Supreme Court of India said civil society did a great job, particularly in relation to migrant labor. And the most important part initially that we did as civil society was provide feedback from below. Food is not reaching. These areas have run out of food. Water is not available. Health gear is not there. Not only providing service, but also providing feedback to district and upper tiers of government to respond in this case. Certainly schemes were announced, you know, like we have a rural employment guarantee scheme. As migrant labor started coming back to villages, that scheme offers at least a job, temporary job, doing some physical labor and some food. But there were problems in the way the scheme was designed and functioning, so feedback from below in order to enable. So many examples of feedback from below, enabling government to improve their targeting and response. At the national level, National Institute of, this Niti Aayog is a national policy body. A consultative machinery was set up with some civil society representatives and some task forces. That is a very good example. And I mentioned to you, the cooperation with the government in terms of the Rural Employment Guarantee Scheme. The most invisible and long-term contribution of civil society in India has been that it has worked in investing capacity in local government and local leadership over decades. So suddenly, local governments and local leaders came forward without any support from anybody, just listening a little bit on mobile phone some information that partner CSOs provided, and they began to look after food, water, quarantine, masks, all these things, washing hands, whatever. Now, this could not have happened if this prior work in building local leadership had not happened. This afternoon, I attended a board meeting of a civil society group working in a couple of our provinces, and they told us the story of how over the last 5 years, they have worked with rural youth to learn how to use digital technology and how to access government schemes for the benefit of the poor. And they were delighted to have that network of 6,000 youth spread over several districts. Now, the ability of civil society is primarily, therefore, this kind of a trusting, widespread community relationship, what you may call social capital, but that work has proceeded several years. However, let me keep an eye on the time. I'm just going to run through this. However, source of life and kiss of death. So civil society government relations in India have gone down systematically in the last 5-6 years. The phenomena are not very different from what Agnes was describing in Hungary. For similar reasons, for a very sectarian, communal, right-wing national government in many provinces too, and a political regime which considers any questioning, any dissent, any critique as undermining the sovereignty of the national sovereignty, national dignity, national pride. So what were some of the contestations? Taking advantage of the pandemic and the lockdown, restricted information and consultation on major policy and legal changes. Environmental impact assessment guidelines were changed so that companies can have unbridled time to mine and kill the forest and capture land and resources from people. Labor codes were suddenly modified with ordinance, with notification. Parliament was not meeting. Parliament committees were not allowed to meet virtually. Parliament was called to meet for a few days, but suddenly stopped because there was protest from the opposition. And very significant farm bills which have changed the agriculture policy of last 70 years in one go, in 2 days, boom. Severe curtailment of any space or conversation of public debate and protest. Lockdown, coronavirus, Disaster Management Act in place, Ministry of Home Affairs in charge, security apparatus is empowered, keep quiet, stay at home, otherwise you'll be arrested. And squeezing of resources from civil society. How? First, within 3-4 days of the lockdown, the Prime Minister announces he has set up a PM Cares Fund where national and international donations are allowed and will be given tax credit. So all the CSR funds, all the international foundation funds have gone into PM Cares. All the money that was available, philanthropic money to civil society, disappears. And important changes during the same lockdown period have been made in corporate social responsibility procedure, enabling companies to put money in Prime Minister's fund and forget civil society. And just 3 weeks ago, a month ago, by stealth, totally by stealth, without information, severe changes in Foreign Contribution Regulation Act brought in, implying that all foreign funded NGOs are enemies of the state, no different from Hungary. And the meeting I was attending this afternoon of the Civil Society Organization Board, 60% of their staff, 60% of their staff are going to lose jobs. They won't have any salary, even for the next 6 months, because the sudden, overnight, non-consultative, boom. Now, obviously, the pandemic has only heightened the divide, heightened the dynamic of contestation, not source of life, but kisses of death are surrounding us, because in the last 6-7 years, these tendencies have been going on. So authority, taking advantage of the disaster management regulations, taking advantage of the lockdown, restrictions of mobility, enormous power to security agencies, a highly authoritarian, centralizing electoral democracy is functioning by stealth. It has systematically captured all institutions like Supreme Courts, Information Commission, Election Commission, or independent authorities, and openly, brazenly violate all norms and procedures established over 70 years of India's independence. It has, over the last few years, systematically co-opted the media and now has used unleashing of fake news on social media. Our Prime Minister is reported to have 40% of his followers, fake followers, on Facebook and Twitter, certified by Facebook and Twitter themselves. And just 2 days ago, 3 of the Facebook staff in India have resigned because it was found out that Facebook was hand in gloves with the ruling party. Exposed by, and therefore silencing dissent through unaccountable security actions. There have been a number of movements in India against a sort of a approach to consider ethnic minorities, Muslims, tribals as non-citizens. So there were a lot of protests on that. And these were building before the pandemic. And now during the pandemic, the cops have gone haywire. They are arresting whoever opens their mouth and put them in jail, and no hearing is done because we are all under lockdown and courts are only meeting virtually. So they will take only very important matters which the state thinks is worth listening to. About a month ago, you may have seen there was a cover story on Time, 100 most important people in the world. And I want to just show you that cover story, the cover picture once again, because it sums up source of life and kiss of death. The Prime Minister on this side, also listed in top 100 people, and this elderly grandmother who sat for 60 days on protest before the pandemic started because of the violation of citizenship rights of Muslim minorities. She is 86 years old. Both of them appeared on Time's cover, Time 100, last month. Source of life and kiss of death. Thank you.
Thank you. Thank you so much, Dr. Tandon. On a lighter side, I have to say we have to stay away from all kinds of kisses after listening to your presentation. Excellent. We have listened to 4 presentations, and I have seen a number of interesting questions, and thanks. Many of our panelists have already attended some of those questions. But let me open this discussion, and just an announcement that those who are participating, you can raise your hand, and if you want to speak, just let me know. We can let you in and share your questions, comments, anything that you want to do. I could see some of the most brilliant names in the attendees list, and if I am not intruding, can I request Professor Tofel Ahmed? It's lovely to you are here, Professor Tofel Ahmed. I'm allowing. It will be interesting to know what is happening in Bangladesh. You can speak, Professor.
Thank you very much. Can you? Am I heard?
Yes, we can hear you.
Thank you very much. In Bangladesh, actually, what Dr. Rajesh Tandon described, Indian situation, is more or less similar. In our case, the NGOs played a great role, especially NGOs like BRAC. They, even before government, they have started responding with their human resources as well as materials to support the vulnerable people in various locations. And the individual philanthropists came forward. Some of them went to NGOs, some of them individually, or have jumped on this situation. One of our health NGO in Bangladesh, Ganashasto Kendro, GK, under the leadership of Dr. Zafrullah Chowdhury, they came up with some of the innovations in the health sector for test kit even, but government did not allow them to do it. So it was also a big row in Bangladesh. Lot of media coverage, even cry. At last, they could not succeed. But in the relief operation, in helping in other sectors, NGOs and civil societies played a great role. I belong to one of the organizations called Shujan, Citizens for Good Governance. We have committees and structures in most of the districts of sub-districts as well. In those locations, they tried help and also bring some sort of information, what is happening where. And at this end, I have to say our media played a great role in bringing transparency. Because of the media reports, our health sector corruption has been unearthed, and the DG Health had to resign, and he is facing now anti-corruption cases. And like many other hospitals, even some of the private hospitals were booked, and it was mainly the press who has done this particular work. So at the end, the government and civil society NGOs work together in Bangladesh, though there were tensions in somewhere, but actually local administration, especially deputy commissioners and the sub-district level administration, local government, they were working with the NGOs, or NGOs were working with them. So I think in Bangladesh, it is a overpopulated country. Because of that, actually, the spread was there, but death rate was lower, and the vulnerable people were helped in a different ways. So thank you very much. When I was hearing the case of Israel and Hungary, I was very much frustrated when the Korean and the Indian case, it encouraged me, because more or less similar things we had in Bangladesh as well. Thank you very much, Mr. Bond.
Thank you, Dr. Hussain. James, would you like to come in? James Taylor from Cape Town, South Africa. James?
It's very sweet of you to invite me in. I was not expecting this at all. I had joined to learn. I think the only contribution I can make, not having done any research, but what has fascinated me through the pandemic is the engagement, involvement of the less formal elements of civil society, where communities have largely been left to their own devices, and the extent to which, neighbors have supported each other. I feel that remarkable. I've heard, stories and been in communication with people who are astounded at the mobilization of human resource at its most basic level, which I always think of as the sort of the source of civil society has been engaged through the pandemic. And what it has shown in our country is a very poor connection at that level between local levels of government and communities. And it's shown that up very starkly. And a much higher likelihood of the more organized civil society organizations to be able to engage at that level, but very little coming from government. I think we have had, just listening to the studies done, my experience of South Africa lies somewhere between the two, actually. Organized civil society organizations have suffered dramatically in very similar ways to those that have been described. But despite that, have continued, often with staff without salaries, continuing to do the work and deliver services where government is unable. So yeah, apologies for not being prepared at all to make a contribution, but wonderful to learn from what has been happening around the world and to be reconnected to all of you. Thank you.
Thank you so much, James. It's always a pleasure to hear you. I could also see Laura Wishwish from Brazil. Laura, would you like to speak? Laura?
Can you hear
Yes,
me?
we can hear you. We can hear you.
You put me on the spot.
I'm trying to bring in stories from other countries as well.
Yeah, no, I think it's very, very rich. I thank you very much for this. It's incredibly rich. I mean, maybe something that to follow up on something that in a way both the speakers but also James just mentioned. I think from observing the Brazilian context as well, it seems to me that a lot of what we would call the formal civil society space has been changing a lot in the last years, not only because of new political forces and new ways of seeing civil society. There are new actors in there. They're not necessarily those we have been paying attention previously. And I guess the pandemic also made us very aware of, I mean, who are we conceiving as civil society, and who are we paying attention, and who are we not paying attention? And in that regard, I think part of not only the informal civil society and the neighborhood associations and others, there have been playing a great important role in the Brazilian context, for sure, in providing services and also in monitoring from below, as Rajesh was mentioning before, or giving feedback from below. But also it seems to me that in the context of Brazil, for instance, under Bolsonaro, there is something about new kinds of civil society that are related to particular churches, and then that have also occupied the space that the state has left. And in that regard, I think even from research perspective, I think we would have to come back and revisit our own ideas of who is civil society and who is not, and who is doing what under the current circumstance. Yeah, those are my initial kind of very, very immediate reactions. But I just wanted to thank you very much for that. This is really, really brilliant.
Thank you, Laura. Richard Holloway. Richard, you have to unmute.
I'm there. Okay, thank you. Very nice to join this group. 3 points. Interesting that a number of people said that local associations of people, as opposed to organized civil society, have been most active during this period. I think that is the case in my country, which is the UK, and in a few other countries that I've had some experience of. And this worries me, because this suggests to me that organized civil society is not doing its job. It is left to informal, newly active groups of associations of people to become active, where previously existing organizations who one thought would become active have not been as active as they would have been, which takes me on to my second point, which is that, does the public recognize the value of civil society organizations and their work during the period of the COVID pandemic? It's important that civil society organizations, if they're going to prosper in the future, even in the conditions of even in the unfortunate and unfavorable conditions of their relations with government, they have to be able to rely upon the people liking them, the people supporting them. And I don't know if this is happening. I didn't find it very clear from the comments of the speakers. And the very last one is to do with the work that I've been doing most recently, which has been in Africa, East Africa, and particularly Kenya. Unlike the other countries which have been speaking, there's a very different situation in Kenya. They've only had up to now about 550, 600 deaths in Kenya. Large numbers of people in Kenya that I've been speaking to they don't believe that this is happening. They think it is a hoax, and they're most worried about the corruption of the funding which is coming into their countries and how this is being stolen by different people. It's not the coronavirus pandemic which worries them so much as the corruption and the excessive authoritarianism of the police. Now, this is being recognized by lots of different people that Africa is less well, sorry, not well is not the word, there's been less badly affected than other countries. But it's important for us, if we're looking at this in the worldwide context, to think that not all countries are the same. Thank you.
I could also see Dr. Samir Chaudhuri. Dr. Chaudhuri, would you like to come in?
Hello.
Yes, Dr. Chaudhuri, we can hear you.
Yes, thank you. Also very unexpected, but hearing Rajesh is very inspiring. Anyway, as organization, we sort of, from the lockdown, we organized food, we organized healthcare, we organized the teaching the people to keep their distance, wash their hands. And because CINI, Child in Need Institute, works in all 4 states, we could do this work in Assam, Jharkhand, and West Bengal. So we were able to reach out to children as a Nutrimix and also to provide messages. And we worked hand in hand with Anganwadi workers and ASHA workers with the government to deliver all this. So I think civil society in India did its part very well, but we are also very worried about the implications of FCRA on organizations like us. And it is almost €500,000 in foreign exchange to do this work. So thank you very much for giving me a chance to speak. And I'm grateful that you have brought all of us together. Thank you.
Thank you. Thank you so much.